Okay, so we had a patient come in, an 82-year-old woman, and she'd been feeling pretty fatigued in the last 3 days. Okay, and she'd had a fever for 24 hours. She reported painful burning sensation upon urinating, and she had to urinate all the time, even during the night. Her daughter became concerned and brought her into the emergency department because she was in the bath and she was feeling so fatigued and so weak she couldn't get out of the bath. So her daughter brought her in. She's widowed and she lives alone, and she has no history of mental confusion. She's usually pretty mentally with it, but she had been experiencing some mental confusion, and when she was assessed, she was only oriented times two, so she was disoriented as to the time and the place of her stay at the hospital. Okay, so her vital signs were of alarm because her temperature was high. She was at 101.8 Fahrenheit. Her pulse was high. Her respiratory was getting up there, and her blood pressure was 102/50 when she was laying down, but in supine, and when she was standing, it actually dropped to 92/42, which is pretty critical with the orthostatic. So that exhibited orthostatic hypotension. Her oxygen was 98 on room air. Okay, some relevant data is that the temperature indicates infection. So we know she has some sort of urinary tract infection because of the symptoms of the pain in the urination. Her blood pressure indicates she has a fluid volume deficit, and so those fluids are not going to perfuse to the tissues properly. So we got some issues going on there. She has a lot of pain when she urinates. That's going to raise her respirations, and then obviously the orthostatic hypotension says that she's not getting that perfusion as well. Okay, when we went through her relevant lab data and diagnostics, we found that her glucose was high, which indicates infection. Her creatinine. These are, as we're going through the labs, we see that her creatinine is high, and that indicates a little bit more than just infection in the bladder and the urinary tract. We're headed towards sepsis, and her kidney function is starting to be starting to show her starting to worsen. Okay, her WBCs were obviously high because of the infection, platelets, neutrophils, her bands. Her lactate, her tissues being deprived of oxygen, and the lactate was worsening as well, which indicates it could be sepsis. Her urine was cloudy. Her specific gravity, her concentration and filtration were altered. Her protein, there was kidney impairment, and we could see protein in her urine. That indicates that. The presence of the large bacteria indicates that she does have that infection in her kidneys, or in her system, and the large bacteria indicates more in the kidney. And then her RBCs, we did see some blood in her urine. Okay, as far as her confusion goes, like I said, she was only oriented times two. What we started with on patient care was we established an IV. We wanted to give her those continuous fluids, a peripheral IV. We were giving her 0.9% sodium with 1,000 milliliters IV bolus, and so she was getting that continuously. Acetaminophen to bring down the fever. We have ceftriaxone, which is the antibiotic to get rid of the infection, but we won't give that to her till after her blood cultures and her urine cultures return. We will be giving her morphine, PRN, which means she'll get it when she feels pain. If she feels pain on urinating, we'll give her the morphine. Okay. As far as nursing diagnoses and interventions, we know she has a fluid volume deficit. That's evidenced by her dry skin, by her orthostatic hypotension, her confusion. We know that that volume isn't being perfused to the tissues. So what are we going to do for her? We're going to establish the IV. We're going to get those fluids into her. We're going to make sure she's aware of what's going on. We're going to orient her often. We're going to talk to her family. Her family needs to be involved. It encourages patient healing. We need to evaluate, and we need to make sure that we're checking her BMPs, we're checking her electrolytes, we're making sure that fluid volume and deficit is being taken care of. Ineffective tissue perfusion, it goes along with the fluid volume deficit. It's evidenced, or it's related to the sepsis, related to renal insufficiency. She's having orthostatic hypotension, the dry mucosa, and she's having a poor cardiac output. That fluid's not in there. She has that fluid volume deficit as well as the ineffective tissue perfusion. That's why we're seeing those dry things. And that's another, we need to establish those IVs, get those pain meds, get her taken care of, orient her often, talk to her a lot, make sure she's progressing in her mentality. And risk for falls. She is confused. She's having a difficult time. She has weakness. She has fatigue. And that's going to make it more difficult for her. She's going to be falling if she gets up because she's weak. And so we really need to watch her. Keep her bag close to the nurse's station. Keep an eye on her. Watch her often. Assess her mentality. We need to make sure that she is safe. And that's the main concern there. We need to discuss with the family ways in which they can keep her safe. We need to clear her room of any obstacles that might cause her to fall. And we need to make sure the lighting is good in there. We need to make sure her family is aware of the safety issues with her confusion and make sure that they take steps at home. And the biggest thing is we need to comfort this lady and help her know that she can be taken care of well. Talk to her therapeutically. Talk to the family. Ease them. Make them feel comfortable. Make sure she's warm. Make sure she's taken care of. And urosepsis is really the ultimate diagnosis here. She went from urinary tract infection to sepsis, and we saw this evident in her labs. We saw this evident in her signs and symptoms, and that's all I have to say.